It's another beautiful Sunday afternoon. Welcome to Ask Your Pediatrician. And of course, this is the program that aims at highlighting various challenges and, of course, that aims at empowering women with information regarding how to, care for their, toddlers, for their babies, and, of course, for their infants as well. All the topics discussed at this particular platform are related to the upbringing of a baby as well. Just a quick recap. Last week we discussed a few things relating to, what you just need to know as a mother, and of course other related issues that you just have to know in relation to, what you need to do in case a child has got, has got fever. What are some of the steps that you're supposed to take? How are you supposed to contain the fever? And of course, when can you actually turn your attention to a doctor as well? And one of the key issues that were actually mentioned by Dr. Marsden is the fact that when your child has got a temperature beyond 37, okay, then, and you detect that perhaps it could be as a result of the fever, you're not supposed to panic. You're not supposed to panic and avoid giving too much things to a child. You buy Panadol, you buy Cafenol, and of course you buy other painkillers so that, you can perhaps, reduce on that temperature. What is important is make the child comfortable. Make the child comfortable, then other steps can actually follow. And the other point that Dr. Marsden had highlighted last week is the fact that, a fever is not necessarily a disease, but it's a triggering factor to tell you that there is something wrong with your child. So whenever you see a fever, just know that perhaps there is something wrong. There could be an infection, bacterial infection, or anything. So the fever is just there to spook you to obviously something bigger perhaps coming. Now, today we continue from there. Today we want to look at, something that is quite common, especially during this particular season in which we are. It's quite dusty, very cold, and a lot of people are bound, to catch a cold, common flu, common colds, and so on and so forth. And of course, children are not exceptional. They are not exempted to this particular weather. In fact, children are more prone to, common colds and of course flu during this particular season. That's the reason why we thought we could discuss this particular topic of importance and of course help, mothers, fathers, and of course other guardians know how they need to protect their children from common colds and of course flu during this period. And perhaps in case your child has got flu or possibly a common cold, what are some of the steps that you can actually take to make sure that you remedy that particular situation? Joining me is Dr. Chaliro Chungu, who is from, he is a pediatrician from Children's Hospital at UTH, who is going to help us understand the two issues that we have at hand today: common colds and, of course, flu. Dr. Chungu, welcome to the program. Thank you so much for your time.
Thank you, Nelson. Pleasure.
Good to have you. The first things first, what's the difference between common colds and flu?
Okay, so those are two terms that are used interchangeably a lot. And common colds, as the name implies, are common. You find them in adults as well as children, but they affect children more. So a common cold is an infection which is most times viral and affects the upper passages of the airway, and usually it involves the nose and sometimes the throat as well. So you find that usually when people say influenza or flu, it's short for influenza, which is a more serious infection. That's the type of infection where you get like muscle aches and you just can't get out of bed. But with most of the common colds, you find that you actually can go about your business. So with a flu, usually flus happen in outbreaks, and they're quite severe. If you remember, there's that time we had an outbreak of H1N1, and we had a few people that were dying, and WHO actually activated an emergency response. So that's the difference. Usually the common cold is the bystander or the more common infection of the nose and throat.
Interesting. What causes common colds?
So majority of common colds are caused by viruses, okay? They are viral. So the meaning of that is that by and large, you do not need antibiotic treatment for them. Now, I mention this fact because, majority of times you find mothers or fathers sometimes when they bring their child to be seen at the hospital, and then you explain that a cold is caused by viruses most of the time. Because of I love the preamble when you talked about fever, because most of them will say, no, but the fever is not going away, the fever is not going away, and so you find them wanting you to prescribe antibiotics. So most of the time, a common cold is caused by viruses.
Okay,
Mm-hmm.
interesting. When you talk about common colds,
Mm-hmm.
are they related to a specific weather condition? Are they seasoned? Or maybe they can occur at any given time?
So common colds are more common in winter months. Most people ask why. There's this theory that the cold tends to make you have a common cold, but things that have been confirmed is the fact that when it's cold we tend to keep ourselves indoors, windows are closed, doors are closed, and that creates like a platform for us to transmit. And then they are also common in nursery schools, especially in kindergarten and early nursery schools. And on average, children get like 8 to 10 episodes a year, whereas in us adults we get like maybe 3, 4. So in nursery schools, the kids are together. If one gets a cold, there's a lot of transmission. And then in this weather, we tend to keep doors and windows closed, and that creates this atmosphere that's very good for transmission of colds. Yes.
Interesting. What are some of risk factors that might contribute to a quick spread, and of course to a quick spread of common colds, especially among little children?
So as I mentioned, little kids, their immunity is not so good. Also, the other extreme is the elderly, and so even flu, like influenza, tends to affect the elderly and the young people at extremes of age. And in children, including maybe like if you have, like I mentioned, those that aggregate, in close weather, and then also hand washing is one of the things that makes us transmit colds very readily. So imagine I have a flu, I'm sneeze into my hand, I come here, I greet you, I shake your hand. All those are potential transmitting platforms for the cold. Also, objects like if I touch, this table, if I leave certain viruses there, they would be there for like 12 hours, 12 to 18 hours. And so someone else comes and touches touch their mouth, nose. So all those are potential sources of transmission. So it's through, direct contact as well as through these objects. So one thing that we didn't look at is also the symptoms of a common cold, and they're not strange since it's common, isn't it? So it's common for you to get a running nose. You can get sneeze, okay, cough, headache, and then in children in particular, they can get an earache resulting from the cold, because as you know, the ear, nose, and throat are connected. These passages are in connection, so you can find that an infection that originates from the nose spreads to the ear and also to the throat. They can get neck ache as well, but of course, if a child has neck stiffness, that's something that we're worried about. Then also loss of appetite, and that's something that's very worrying for parents. If your kid is not eating as they should, it's quite worrying. So they become a bit fussy during this time, and you find you have to be a bit creative with offering them foods. So as we mentioned, nasal congestion, there's that little baby who's sneezing, irritable, has a decreased appetite, is coughing, difficulty sleeping as well, and they may have a low-grade fever. Remember, you mentioned that a fever is a response that tells you that there's something that's wrong with your baby. So fever with a common cold is not uncommon, and they actually have usually a low-grade fever, 38, sometimes even as high as 39. But of course, if you're worried as a parent, you can ask to see your pediatrician, just to check your child out. But most of the times, if your child is alert and you've taken those steps that you mentioned last week with Dr. Marsden, then you can be rest assured that your child will get better.
Interesting. Can a common cold get to extremes in terms of even turning into flu?
So, remember from the beginning we mentioned that flu and common cold are different in the fact that a common cold is mild and is caused by different organisms as opposed to flu or influenza. So if someone with a common cold gets a flu, then they have something else that comes to add on that infection. So a common cold can have certain complications that can result from having a cold. Like, from the cold, maybe you can have a sinusitis that's common in kids, and then we looked at that kid on the picture who had, an ear infection. Sometimes you can get the cold causing wheezing or asthma. Like for children who are predisposed to having wheezing attacks or, allergy, a small cold can then result in them having an episode of where they have difficulty breathing and making those sounds that asthmatic children can make. Or sometimes even without them having asthma, they can just have a wheezing episode, which we won't call asthma yet. So those can be complications of a cold, but the majority, by and large, of the common colds are uncomplicated and they don't complicate.
Yeah. Interesting. All right, in case you're just joining us, this is Ask Your Pediatrician, and of course, today we are discussing common colds and of course, flu as well. For any questions, any queries, you are free to send us a text on that number that is on your screen, just below the topic. There is the number 0955 5016. So you can send in your queries and of course your messages, and I'm sure that Dr. Chungu should be here to respond to some of your questions. It could be that you have observed something funny in your child, and you haven't yet taken a step to go to a hospital, and you just want to find out something. Well, you can definitely ask a question, and I'm sure that Dr. Chungu should be able to respond in line with what we are discussing today: cold and common colds, and of course flu. Now, how would you differentiate between common colds and flu? Like, for example, for a layman mother, how could she differentiate to say my child has got only a common cold or perhaps has got flu?
So, flu, influenza, usually has in addition muscle pains and like I said, a child with a common cold is alert, is playful, with occasional episodes of irritability, fussiness, but generally you find them walking about. And a lot of parents actually like laughing, when they bring their child to the hospital. You find a child who was in the night gave them a tough time. This is a child who was, up and about, congested, who was up most of the night, congested nostrils, and then they walk into the consulting room and this child is, bouncing up and down. So we understand that can happen at night. The flu itself tends to be more severe. They can't eat, they've got, and it's not that common in children because, as I said, it happens in outbreaks. But another important thing about the common cold that we need to touch on is diagnosis. The diagnosis of a common cold is mainly clinical. So we make it by listening to what the mother says, and it's those signs that we looked up, that we looked on the screen where the child was sneezing, nasal congestion, the difficulty sleeping, and then once we have that, most parents like to ask, but what specific virus or what specific germ is causing this illness? And our response is always that there are so many viruses that can cause a common cold, and so it's not practical for us to isolate that germ, so you can you can, but by very expensive methods, and it won't help us, because as we mentioned, most viral infections don't have specific treatment. So in terms of diagnosis, is clinical, and you won't have any results that any test that will pinpoint and say this is what's causing it. But sometimes maybe your doctor would want to do, if maybe your child is showing signs of having additional infection to the virus, you can maybe do a full blood count. You can do a malaria slide just to check if there's other causes of that fever or whatever is found on examination. But most of the time we can't diagnose.
Interesting. Is flu treatable?
So flu in itself, influenza, if you remember from the outbreaks that we've been having of flu, the H1N1, there was some drugs were released on the market that are able to treat flu. They're not very widely available. And when you say flu, here we are talking about influenza, by the way, and not common cold. So influenza in itself, and then there's a vaccine for influenza. So there's a vaccine that's been licensed by the World Health Organization. And for that vaccine, it's not to be given to everyone routinely, but like in other Western countries, they give the vaccine to people who are prone to having severe disease, like the elderly or immunosuppressed people, like people whose immunity is not so good, maybe people who are on drugs that can worsen their immunity. Or if you're HIV positive and your viral load is high and your CD4 count is down, then you'd be a candidate for the flu vaccine, because if you get that flu, it can then complicate and even lead into severe disease and even death in extreme cases. So now for the common cold, there are no drugs per se, because remember, as I mentioned, it's viral. So essentially, the treatment that we do is symptomatic. So what do I mean? Like, for a small child, you would, there's something it's mainly making them comfortable, symptomatic, like you were discussing with fever control. So you would do the same steps that you talked about in fever control, expose the child, get a cloth dipped in some warm water, sponge them, give them some cowpaw if you have. Then in addition, you want to, because remember, even when an adult has the flu, it's quite distressing, isn't it? Like your nostrils are blocked, you just feel congested. So now a child whose airways are much, much smaller than an adult. That's a picture of the pipes or the airways of a small child. And you can see that when there's mucus, mucus that happens in when you have a flu. So the mucus plugs the airways and they're not as open as they would be normally. And if you can see, even in the lining, they're red, they're swollen. And so that can be pretty discomforting. And so measures you want to do are things to make the child comfortable. So parents can get, previously, mothers used to suck their children's nostrils. That doesn't happen anymore. But then there are ways now that you can make that a bit pleasant, like there are devices that we use, suckers, that the mother can put in the nostril of the baby and just suck out some of the mucus, and you get instant relief when you see some of these things being done. That's a mother, there's a pipe that's connected to that sucker that's put in the baby's nostril, and then the mother is sucking and removes the mucus so that the child can then breathe better. And then symptoms tend to be worse at night, because at night temperatures drop, the child is lying flat, so then mucus will plug those pipes, and then it will make the breathing a bit worse. So we mentioned temperature control, we mentioned getting rid of the mucus, and then there's things you can do, like you can use eucalyptus oil, to sort of just aerate the passages. And then in terms of drugs, again, I mentioned antibiotics do not treat the common cold. And I keep stressing this point because common colds are the majority of outpatient attendances all over in the world. So be it in the Western world, be it in our setting, the majority of children who come to outpatient and adults, it's because of a common cold. But a lot of these measures are measures that can be undertaken at home. And you find that you don't even need to see your doctor unless you have particular concerns that your child's condition could be more serious. So foods also, you want to make sure they're well hydrated, they've taken in a lot of food, they're well hydrated, and also that they're taking a lot of fruits and vegetables to help them get better.
Interesting. So from your explanation there, common colds are quite common,
Mhm.
and they affect almost everyone.
Mhm.
Exactly. And now, pneumonia at the moment is difficult. Flu at the moment is difficult to treat. How about a common cold? Is there a specific medication that can be administered to a child who's got a common cold?
So again, flu, like, so once, I'm sure a lot of kids who take a lot of parents,
Mm-hmm.
I notice we're saying mothers, 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 but I'm an advocate that it should be a balanced, so mom and dad, I've seen a lot of motivated fathers. So parents who take their kids to be seen for common cold, flu. Um, like we said, that most parents will come and say, "Oh, I went to this facility and they told me there's not much that they could do." So it's reassuring a parent, because when your kid is unwell, mothers are quite distressed. So one is reassuring the mother that this is self-limiting and it will get better. It doesn't get better instantly. Usually the period for a common cold is like, when it starts, by the third day, it peaks. That's the time when there's, severe mucus, severe congestion, and it lasts up to like 7 to 10 days. Now, after that 7 to 10 days, there's what we call a post cough. Like afterwards, you can have a cough that lingers, sometimes even up to 2 weeks. So remember, that's because the pipes are settling down from all that swelling that was happening. Now, a lot of times parents will get very concerned, even for a child who's very active, and so they go and buy over-the-counter medications, and most cough flu medications are actually not haven't been proven to be of benefit in children less than 2 years, and so you find that they're not necessary. So that's for treatment of a cold. But for a flu, its treatment is also supportive, like I mentioned. Supportive, remember we said additional symptoms of influenza is muscle aches, chills, where someone is so weak, they can't eat as much. So, depending on the setting and the availability of services, you might be able to benefit from certain drugs. But then by and large, also the treatment there is supportive, just like the common cold. Except I'm sure once or twice you might have had a flu, a really bad cold that just left you drained with muscle aches and chills. You were shaking, to the point of even thinking you got malaria. So for children younger than 2, in some places even younger than 6, you won't find cough medications being prescribed. So, which leaves us to the important things of what things can mothers give as home remedies, mothers and fathers. What things can they give as home remedies to make kids get better?
Maybe at this particular level, doctor, maybe now try to help us understand how Piriton comes into the whole entire setup here, because I think it's quite common when even an adult, when an adult has got flu, cough, they would go for Codril, they would go for some of these, and of course they would go for Piriton. And in most cases, when you look at Codril, you'd find that there is a Piriton in there, and of course other combinations as well. But Piriton is always present there. So is Piriton the medication for flu or common cold?
Thank you, Nelson. That's a very good question. And so, Piriton is a drug that works by basically reducing your sensitivity to like we call it a decongestant. It decongests, if you may. Now, one of the side effects, I'm sure you've taken Piriton several times. What's one of the side effects?
Obviously you feel dizzy.
Exactly. And you end up sleeping.
Exactly.
So the thing is that, most of these drugs that will work in adults do not work as well in children. And sometimes, and in fact a lot of times, our fear as pediatricians is the fear of side effects. This is already a child that's sedated, that's already drowsy, and then you want to further make them drowsy. So again, there's this thing out there where people just think flu, Piriton, and it's psychological. So for children, again, there is no benefit that has been demonstrated by illicitly giving drugs like Piriton. That's one of them. Another commonly abused one is amoxil, that people just walk over to a pharmacy over the counter, come out with amoxil. That won't work because remember we mentioned it's viral. Okay, so Piriton would help you settle down as an adult, but for children, no. Okay, it hasn't demonstrated benefit. So, what are some of the things that you can do? Not taking from the fact that it's very distressing to have a child with a common cold in the house. So what things can you do to make this child comfortable? So temperature control, as you discussed last week with Dr. Marsden. So you make this child all those strategies that we discussed in terms of temperature control. That's one. Two, the thing we mentioned in terms of decongesting the nostrils. That's another one. Three, you also want to, give foods that, for example, if their throat is a bit congested, you don't want to give thick foods that will be a bit difficult. So you give slightly lighter food. And of course, they'll be fussy, so they won't take in as much as they will. So you have to be a bit creative and use foods that they like, as opposed to just, of course, not if they like ice cream, you can't be giving ice cream, but, foods that they like that are nutritious. So, you puree the food, you make it of lighter consistency, and then also create a warmer environment in terms of when it's cold, then it tends to even make the symptoms worse. And of course, breastfeeding has been proven to lessen severity of colds in countries that are less developed like ours. But that type of benefit hasn't been demonstrated in the West. So a child who's got a flu and who's fussy, sometimes all they would want is the breast. So that will at least you're rest assured that your baby is breastfeeding and getting some nutrients, and that becomes a problem for the babies who are prematurely discontinued from breastfeeding, because our recommendation now is to say breastfeed until the baby is 2 years. So for those that prematurely stop, the child is being fussy. That's one of the disadvantages, in that you can not offer them the breast and they won't have some nutritional supplementation. So that's another strategy that can be used, as well as just comfort. A sick child wants to be close to the mother or the father. So just keeping the child close reassures them, makes the child feel more comfortable, and makes them less fussy and able to sleep at night.
Interesting. In line with supplements and all that, how about is it advisable when a child has got common colds, or worse still, they have flu? Is it advisable to give them things, for example, fruits like oranges and other fruits? I think I've seen this being practiced by quite a number of mothers. And how about liquids such as water? Is it advisable?
So those are the things that you actually should maximize on, like with fruits. Except if you, like, you remember I had mentioned that if you give them like rough foods, they may bruise them, or they might have discomfort, and so they won't like them as much. So that's where mothers have to be extra patient. Mash the food, puree it. So you find you get an apple, mash it, give it to the child. Sometimes you might actually warm it a bit to make it softer. A lot of work, huh? Warm it to make it softer, and then give them to the child. Vegetables can be blended, mashed, mixed with potatoes, add a bit of milk there to make it a bit runnier, and give them. And you see that, having a child with a common cold requires a lot of attention, because then, they have to spend a lot of time with the mother or the father, and so water also is good because it moistens the airways, because as you are, when you got a flu, sometimes you mouth breathe because your nasal passages are blocked. So all that mouth breathing is releasing a lot of vapor, into the atmosphere. So you get dehydrated. So, keeping the fluids help to keep you moist, and just lots of fluids, lots of urination help to flush out toxins and to just maintain the water balance.
Is it advisable to give cold water to somebody who's got flu or common cold? Because if I got you correct, you said when a child has got common flu and of course common cold and flu, to say, you need to make sure that the environment is more comfortable, and this also includes making the temperature of the environment a bit warmer, so that they don't get attacked by cold and stuff like that. But now we talk about a liquid that is supposed to be taken cold. So maybe Maybe you're saying we should warm the water a bit before taking it.
Exactly. I had mentioned, remember we had started talking about some of the home remedies that you can use. So one of them is actually warm water. Of course, cold things are not good for children with a cough and cold. You can see it, just you give them something cold, they start coughing because their pipes sort of, like cringe up, or they become narrower. So a warm drink is very soothing, even for an adult. You take something warm, you feel a bit opened up, you feel a bit more comfortable. So even for small babies, a warm liquid, usually for children above 1 year, you can give them a honey lemon water solution. Okay, that's something that's actually recommended. Honey lemon water solution, it soothes the throat and makes them a bit comfortable. Doesn't cure the cold. The common cold doesn't cure it, but makes them a bit comfortable and less fussy. So honey is not recommended in children less than 1 year. Okay, it's got a risk of them getting certain diseases. So less than 1 year, honey is not recommended. Okay, so a child lemon, yes,
okay.
You can. Okay, so you can lemon in water, warm water, just to soothe. So honey, not for children less than 1 year. So honey lemon solution is something you can give to open them up, and if most home remedies, some people talk about soup, so all those are just foods to make a child more happy, comfortable, settled, and yeah, we mentioned the temperature as well.
Okay, among the home remedies, can we also include combination of or maybe ginger tea and maybe ginger lemon combined?
So tea is something that we tend to not encourage to be used in children.
Okay.
Because tea has a certain substance that can affect the way they absorb their iron. So then it makes them get anemia, like iron deficiency anemia. So it's actually common practice to be given small children tea. And another thing also is that you see tea is not very nutritious. And so you find you give this child a cup of tea, you fill them up with a cup of tea, then you don't have any room left for more nutritious things. That's tea. But tea in itself, not recommended for children, but ginger can be given to children older than a year. You can give them ginger, honey, lemon. But the most recommended and studied effect that has been said to have benefit is honey lemon. Now, there are a lot of home remedies, a lot, a whole lot, and a lot of tales out there of what makes a cold better. I remember a mother was telling me the other day, oh, chew on garlic, let the child chew on garlic, and all those are things that are not very palatable for kids. You puree whole garlic and you give to a child. Not very, and so I remember this grandmother telling me, I said, oh no, some of these things we've noticed work. So I said, okay, if you've noticed it works, as long as it's not harmful and you discuss it with your pediatrician, before you decide to use it. Because imagine if you were giving honey to a 6-month-old after what we've talked about, not a very good strategy, isn't it? So there's a lot of home remedies, and before you want to use something a bit extreme, I think it's nice to discuss with your healthcare provider and just clear some of those things. Another thing that's been studied is vitamin C. So there's this thing I always hear people saying, oh, my kids don't get flu. I used to give them vitamin C and they stopped. So then you find that maybe their kids are like 5 years or 6 years. So they've probably just gone to that age group where their flus are not as common. Because you find that as children grow older, they develop a bit of immunity and become a bit resistant to some of these infections. So all those are things that parents would give, but they are not things that from things that have been looked at. They're not things that have benefit. So again, we repeat, antibiotics are not a mainstay for treatment of flus, and sometimes you find that doctors are pressured into giving these things because the parent will ask that, can we be given this, can we be given. I remember being surveyed by a pharmaceutical company that wanted to find out just how much pressure we get from parents to prescribe antibiotics when their child's flu is not getting better. and they had told me that they actually found a large proportion of healthcare workers, more than 80%, who prescribe antibiotics for a flu due to that kind of pressure. So Piriton, flu, young children, no. Unless your doctor maybe sees something that or examines and finds something that warrants treatment with antibiotics. Yeah.
Yes, you're watching Ask Your Pediatrician, and of course, my guest today is Dr. Chungo, and of course, he's trying by all means to help us really understand the difference between a common cold and, of course, a flu as well, and some of the steps that you just need to take, and just to ensure that you get it right as well, both from a clinical point of view and of course home remedies as well. Remember, the number is 0955 5016, 0955 5016. You can send all your questions to that number, and immediately after we get back from the break, we'll be looking at some of the questions that are coming in, and of course Dr. Chongo should be able to respond to that. For now, we take a break. We'll be back.
Hi, my name is Machamanda. I bring to you the 169 on QTV, your number one show transcending all the imaginable barriers, discoveries, explodes, realities, and the dares, all in one package, uncovering the beauty of your nature in the air, on a safari, on water. 169. Here we believe the style is the only real luxury really desirable. In the 169, we will take you there. Call us, we shall come there. The world is waiting. Catch me every Saturday at 6:30 p.m. Exclusive QTV.
Proteins, zone 5, plus I got kicks, my dog.
Lots of love to QTV. Love you. Hi guys! Hello, beautiful people! Very best of entertainment, fun, excitement, and everything LSK.
Everybody who's in Zambia, you're Zambian too, you know what I mean? So, yeah, man, we're just so happy.
But truth is that God can reverse your condition. It is time for you to call out to your friends because God's hope has given you such a catch. This is Bishop Eddie Mulenga, and by the way, they just call me the Bish. Moments of inspiration. Tell your friends, the Bish is coming on air on Moments of Inspiration, and it's only on QTV.
Hi guys. Hello, beautiful people. Very best of entertainment, fun, excitement, and everything LSK.
Everybody who's in Zambia, you're Zambian too, you know what I mean? So, yeah, man, we're just so happy.
All right, so welcome back. 0955 5016 is 0955 5016. That is the text line. Okay, so for all your queries, all your questions, please send them through that number. And of course, obviously, my guest will be at hand just to receive them and of course be able to interpret the situation to you. What is important is for you to understand the situation. So Dr. Chungu will be interpreting the situation for you. Most of the text messages that are coming in are situational text messages. So I would like Dr. Chungu to interpret the situation that mothers are going through, that mothers are seeing, so that you now know exactly what you can do. But when it comes to prescription of medications, in most cases we advise that you go to the hospital, you go to a clinic, and of course meet a clinician, a healthcare provider, and of course let them conduct a complete diagnosis. That's when they can be able to administer. So during this discussion, Dr. Chungu might not really be at liberty to tell you to say, okay, go and buy this medication, because he hasn't conducted a complete diagnosis. But he's just going to present an overview of the situation that your child might actually be going through, so that tomorrow, Monday, you go to your clinic and of course meet Dr. Chungu and other healthcare providers, and they should be able to assist in that regard. All right, so now we begin looking at our text messages, and the first one, Dr. Chungu says, my child is having difficulties in breathing. No wheeze, and the breathing goes like, I'm trying as much as I can to demonstrate how this message is written. Exactly. So, is having difficulties in breathing, and the sound is more like a painful sound. Could it be pneumonia? And what can be done to improve the situation? And how long should it take to see improvement after Cristapen injection?
Okay, so first of all, your improvisation skills are very good. The way you just transcribed that message into actual movements. So I see a description of a sick child there. You know, someone who's having pain as they're breathing. It could be pneumonia, however, it could be other things as well. So I think one of the skills that I always marvel in mothers is just that recognition of a child who's unwell. And so, mom, if you're listening, please take that child to be seen, not tomorrow, but as soon as possible, so that if it's pneumonia, they can be treated. Usually pneumonia, I'm actually surprised how there's a prescription for a drug already. Like
Exactly.
she's saying,
There is Cristapen here.
Cristapen. So I'm wondering, is it a child who went to the clinic and then was given injections and is having injections and then they're not improving, or is she asking if they are going to give that injection? That's not very clear. But what's clear there is that this child is unwell. And so for this child, please, can you take them to be seen by a clinician, to be examined, examine the chest, examine, the throat, the ears, the nose, and just, give you a proper advice, because it's difficult, as you said, from, just giving like an accurate diagnosis like that. But that sounds like an unwell child, and please, by all means, do take them to be examined. And then you asked how long it should take for someone to respond.
How long does exactly to start showing signs of improvement to Cristapen?
So that would depend on the severity of the pneumonia or of the infection, because usually we say, and remember, pneumonia is usually bacterial. We deal with, so it depends on the severity of the infection, other surrounding factors, to say that it should take this long for the child to and also in a lot of other things. What's the HIV status of this child? are they eating? Are they are all these other, there's sort of a lot of other surrounding factors.
Maybe just try to clarify on one thing here.
Mm-hmm.
What is this cristapen drug that has been indicated here? Is it an injection? Is it a drug? And what is it used for?
So cristapen is penicillin. It's a
Penicillin.
Yeah. So it's a penicillin injection. That's
Okay.
what cristapen is. Benzyl penicillin, and usually it's given either an injection into a muscle or into a vein. That's why I'm surprised they're at home
Okay.
and they're discussing. Yeah.
Okay. Interesting. The next text here says, my child usually wheezes when she has flu. Why is that? And is she asthmatic?
That's a very common question. I'm not surprised it's come through. So if you remember in the initial stages of our discussion, we had mentioned that a common cold in children who are predisposed can make them wheeze or make them. So younger children also will wheeze even when they are not asthmatic.
Okay.
Because just like there was that diagram that we had earlier on that was looking at the passages of the children and how they are small, and how that when they get an infection they can get plugged. So a wheeze will usually result from trying to push air through a very small pipe, kind of like what you do when you're whistling. Okay, so if children, because their pipes are smaller, they may tend to wheeze because a common cold will make them be plugged with mucus. So young children can get wheezing episodes. As to whether they're asthmatic or not depends on whether they now have a genetic, like maybe by family, usually asthma runs in families. So do they have a genetic predisposition to wheezing? Or maybe putting that simpler, did they get something from their parents or their grandfathers or whatnot that makes their airways react like that all the time, and those will now persist with their wheezing episodes? There are certain diagnostic tests that we do also for predicting whether a child has asthma or not, certain machinery, but they require a child to be cooperative. But then for the one who wheezes, we can't say from the history that you've given only. So it's possible it's not, but usually most kids have wheezing episodes when they're young, and they grow out of it. As they grow older, their pipes become bigger and their airways become less responsive as they were when they were younger.
So what causes that wheezing is because of the nature of the breathing pipes?
Yes, the fact that they are smaller, the fact that they get clogged with mucus, and the fact that some kids have sensitive pipes, which can get less sensitive as they grow older.
Interesting. The next text here says, hi doc, my daughter is 18 months, has swollen nasal turbinates unilaterally for 3 months now. Could it be nasal polyp?
Okay.
What medication should I give?
Okay, I'm actually wondering how mom got to know that there was a swollen turbinate unilaterally. That sounds very medical, but anyway. So I can tell that this is a mother who's been in contact with a healthcare worker, in one way or the other, whether electronically or physically. So to start with, usually what she's saying as nasal turbinates, if you look inside, she's saying on one side of the nose there's a swelling that's protruding. So certain kids with allergies can have swollen nasal turbinates in both nostrils, okay? And then that's usually like people who have allergic rhinitis or whatever, they are fluey most of the time and they're well. So on one side, it's unlikely to be it's unlikely to be like as a result of allergy, because why should it just be one nostril? So usually it's in both nostrils. So yes, it could be a polyp, ma'am, and by all means, I do advise that you probably see an ENT specialist. For now, I can't start recommending treatments as we said, but you can see an ENT and see whether there will be need for it to be, depending on the size and whatnot. It can be a polyp, yes.
The next one says, good afternoon. What is Divaprox sodium and how does it work? Or what does it work for?
Okay, so divalproex sodium has nothing to do with this discussion of the common cold, but however, it's a drug that's used for children who have epilepsy or convulsions. So that's what we use it for in terms of treating seizures and mood, like children who are mood disorders, like maybe kids who are hyperactive and things like that, because it's a mood stabilizer. So in terms of the common cold, it's not, it's got no place.
Okay, interesting. So now maybe for the sake of this text message and what we discussed with Dr. Marsden last week in relation to fever, because at some point it was established that fever could cause convulsions in a child, depending obviously. And now in line with this text here, is there any reaction as a result of extreme common cold or extreme flu that a child may exhibit? For example, are there any cases that if some children who have extreme flu can convulse?
Exactly, and that's actually one of the most common, if not the most common causes of a febrile convulsion. And remember, with a febrile convulsion, this is a child who's usually 6 months, between 6 months and 6 years, or some will say 5 years, 6 months to 6 years, who convulse when their temperature gets, shoots up. But the thing is that their convulsion usually is short, it's not complicated, and they, after convulsing, they're alert, and they're alert, they're not like under. So we don't typically treat febrile convulsions with anticonvulsants unless there are other things that are accompanying that febrile convulsion.
So Divaprox is an
convulsant. Yes, and a mood stabilizer.
And a mood stabilizer.
Yes,
okay.
But not for febrile seizures.
Okay, so it cannot be used. It cannot be actually administered to somebody who develops, febrile convulsions or something.
It can for complicated febrile seizures.
Okay.
So that's a decision that should only be made by your doctor.
Okay.
To say that let's use this. But usually more simple febrile seizures, as you discussed, they grow out of it, they get out of it. So usually the flu, you find it starts off with the flu, then the child convulses. Maybe by the time you're even getting to the hospital, this child is fully lucid. They are alert and yeah, it's almost as if sometimes the doctor might not even believe you. Like it's that dramatic. But of course, a convulsion is very dramatic for a parent. And we understand when parents bring a child in that this was, and we understand. But then we have to really look at everything in totality before making those types of decisions.
Interesting. The next one says, good afternoon. This is Mr. Chola from Ndola. Is Puriton syrup recommended for children with 3 months? If yes or no, what is the best medication to give if they have flu, apart from normal breastfeeding and massaging of the nose with lukewarm water with a bit of salt?
So Mr. Chola, the salt in there, I don't know where it's come from. I think from what we've discussed, we didn't mention any lukewarm water with a bit of salt, no. So, and Mr. Chola, you've actually elaborated a lot of steps that will make your baby comfortable, but Piriton syrup, no. So I think that's actually one of the questions you asked Nelson about, Piriton and this myth out there that Piriton is for flus. So Mr. Chola, how you would help the 3-month-old babies, in addition to what you've mentioned, give them a lot of love and support. You can give them suction. There's that diagram we had of that device. If you can't get that device, there are other suckers you can use. Bennett's has them, or you've even found over the counter. There are some that just have a bulb, like a bulb and a sucker. Or you could just go right old-fashioned and suck the nostrils out. Otherwise, again, we mentioned that a flu is self-limiting. What does self-limiting mean? It runs its course and finishes, even adults. very few are the times when you go and start, taking Piriton for your flus. But your common cold, will eventually clear off, So again, for the 3-month-old, no Piriton syrup, no cough syrup, just for the 3 months, just Panadol if there's fever. If you're concerned, maybe child is not breastfeeding well, if maybe baby has a convulsion, if the other is breathing fast and you are seeing that he's really having difficulties breathing, you can take them in to be examined to see if it's more than a common cold. But most common colds, kids run around, with running noses, they're playing around, and so they don't need these medications that parents will go over the counter to go and buy, the Piritons, especially the infants. The Piritons, the amoxils, the other antibiotics because you find sometimes kids go through so many cycles of drugs, and that's not good for children in terms of side effects, and also there are several consequences of antibiotics, antibiotic resistance, and secondary complications.
Let me look at the last 4 messages, as time is not really our best ally. Sonny says, a TB patient, I have a persistent cough and a running nose, especially at night. What do I do? Joe from Mongo. And of course, this one says, is it safe to put salt in food for babies below 1 year? And this one as well says, Dr. Chungo, if you say Piriton has no value in the management of flu, common cold, why then do we have Piriton suspensions for children? Brian. And this one as well says, I would love to know the difference as well between pneumonia and coryza in terms of clinical features and how I should come up with this diagnosis. And this one as well says, my 3-year-old and my 1-year-old having been coughing for a month. Is there a home remedy that can help us? Good afternoon, doctor. My daughter was admitted in UTH for 7 days while on oxygen. She was found with pneumonia and finished the treatment in December last year. But whenever she has a flu, it's always very difficult to breathe, loss of appetite and high temperature. And she is now 1 year and 10 months. Monga, Newman, and Lasaka. And the last one for now says, my child is 4 years old and has a severe cough. We give all sorts of medicine, but it's not finishing. And the other people told me it's academy. So what should I do, George Chirundu? And maybe for the sake of our viewers, really, we'll be discussing pneumonia next week. Exactly. So all these questions relating to pneumonia, plus this, plus that. Dr. Chungu is coming to discuss pneumonia next week. So make sure that you make a date with us next week when we'll be discussing pneumonia in detail. So all these whereby, you are once on treatment for a child who's on treatment for pneumonia, and after some time, some similar symptoms start, developing and so on and so forth. I think Dr. Chungu will come and address them next week as well. Maybe for the sake of time, Joe from Mongo talked about TB, exactly, and now has got a serious running nose, especially at night. What should he do?
Okay, so for again, this program is not a substitute for seeking medical care. That should be stressed from the beginning. So for Joe, just because someone is on TB treatment, it doesn't mean they cannot get a flu, because as we said, viruses cause flu. So you can get a flu with TB, but however, if you find that there's a persistence in your symptoms like coughing, fevers, night sweats, then you need to go and tell your healthcare provider so that you just get reevaluated in terms of the TB. But someone with TB can get a flu. It's not uncommon. But if you feel that you're getting the same symptoms that you had initially when you were being put on the TB treatment, just let them know and they'll take appropriate tests in that direction. There was
the other one, I think more critical for now, is if you say Piriton has no value in the management of flu and common cold, why then do we have a Piriton suspension for children?
So again, let me make my statement clearer. I did not say Piriton has no value. You have to look at the age group of the child. So if you look at the boxes for most of these syrups that are available, the pharmaceutical company even gives you a caveat on what age group to use. So generally for children less than 2 years, we do not recommend those sorts of things. Some even go as 4 years. So if you look at the box, just look at the box itself. It will even tell you to say not recommended for children in this age group unless recommended by your doctor. You know, because of the fact that they haven't had demonstrated value in the younger children, the ones less than 2 years. So you still have the syrups for the 5-year-old, for the 6-year-old, for that will have a flu, in whom they maybe benefit from the Piriton.
Interesting.
Yes.
All right, so ladies and gentlemen, that's it for today. Thank you so much for your time. Thank you so much for your response. Thank you so much for some of these questions. But if your questions hasn't been answered, make sure that you join us next week on Sunday between 13 and 14 as Dr. Chungu will be highlighting more on, coleser and, of course, pneumonia and other related, inquiries that you have made today. I've been your host, Nelson Zulu. On behalf of everybody involved in the production of this program, it's bye-bye.